Hello, my name is Nuhanani and welcome to my presentation. As an introduction, program outcomes are a set of knowledge, skills and abilities students are expected to attain at the time of graduation. In Bachelor of Pharmacy, these are the program outcomes. I will use program outcomes or PO interchangeably throughout the whole presentation. Now, the problem here is that it is unsure of how well recent graduates have attained the PO. There is also a lack of evidence on effectiveness of integrated curriculum, and it is unsure whether graduates are satisfied with the overall pharmacy program or not. Thus, this study aims to assess the achievement of PO in graduates of Bachelor of Pharmacy from graduates' perspective. The objectives are to assess level of attainment of PO in recent graduates, to compare between indirect assessment with direct assessment, to compare the effectiveness of integrated curriculum over the old curriculum, and to assess overall satisfaction of graduates towards pharmacy program. Now, for methodology, 59 graduates who graduated in September 2020 and have undergone the integrated curriculum are invited to take cross-sectional survey. For the questionnaire, it is divided into 3 sections. For the validation of questionnaire, Dr. Rohaya Talib and Dr. Hajah Zainab Muhammad Noor were invited to give their inputs. For the reliability of questionnaire, Cronbach's Alpha was used. As for the pilot test, 20 graduates graduated in 2017, 2018 and 2019 were invited to take the survey to obtain their feedbacks. In the main study, the questionnaire was disseminated in April 2021 through WhatsApp. Graduates were reminded twice, and those who have not responded within the time frame were considered as non-respondents. Data was analyzed using the Microsoft Excel. In evaluating the level of attainment of each PO, 5-point Likert scale was used. Agree and strongly agree responses were considered as positive responses. Percentage of positive responses was calculated using this formula, and outcomes of more than 70% positive responses is considered as achieved the set PO. Results from this will be compared with study done by Nur Fatiha Muhammad Ali and direct assessment in the form of examination results. Results obtained will also be used to compare between previous studies to assess effectiveness of integrated curriculum over the old curriculum. Last but not least, the overall satisfaction of graduates will be assessed by calculating the percentage of positive responses, and outcomes of more than 70% positive responses will indicate achieved satisfaction in certain element. During this study, expert panel commented that the questionnaire was easy to understand and no amendment was needed. For the reliability, the Cronbach's Alpha for section B was 0.9 and for section C was 0.8, and this questionnaire was considered reliable. As for the pilot test, the graduates commented that the questionnaire was simple and straightforward, and the average time taken to take the survey was 10 minutes. In the main study, 35 graduates have responded, and this is the table of demographic characteristics. It can be observed that most graduates favor the public sector, which could be due to higher income in the public sector. In achievement of PO by graduates, these are the results. PO1 involves the knowledge in pharmacy. The reason why graduates believe that they did not attain PO1 could be due to the rapidly evolving future. Papadopoulos suggests that new therapeutic approaches, major changes in drug distribution system, and automation or robotics are knowledge pharmacists have to know but hard to obtain. As for PO2, it involves the technological and industrial side of pharmacy. It could be due to lacking of practical courses on these elements. Al-Namrawi found that pharmacy students have poor awareness on technological knowledge because of the lack of theoretical and practical courses. Similarly, pharmacy students have to undergo industrial attachment for 2 weeks only. Other than that, 91.4% of graduates are working in non-industrial area, in which the results might be slightly biased. Last but not least, graduates did not attain PO8. PO8 is the management and entrepreneurship skills, which are heavily focused in industrial and community pharmacy. It could be due to lack of time, where graduates back then have to undergo industrial and community attachment for 2 weeks only. Other than that, most of the graduates are currently undergoing PRP trainings in hospital and health clinics, which might lead to biased results. In comparison between graduates' perspective and employers' perspective, these are the results. For PO1, the difference could be due to graduates who self-assessed themselves to be worse than they actually are, as biased self-assessment is commonplace. For PO2 and PO8, it could be due to current curricular design and delivery that does not support attainment of PO2 and PO8, or it could be due to having employers who are mainly hospital-based, which might affect assessment of PO2 and PO8. In comparison between indirect assessment with direct assessment of PO, these are the results. For the examination results, these are the percentage of students scoring at least 50% of final marks. The reason why there is a major difference between direct assessment with indirect assessment could be due to difficulty attaining knowledge once graduated. In bachelor's degree, students are tested on what lecturers have taught. However, during workplace, students or graduates might even be asked by employers on topics that they never even heard of. Other than that, it could be some flaws in direct assessment. Royer reported that examinations may have some vulnerability, where students may answer the questions correctly even with little subject knowledge. Thus, it is recommended to increase assessment on students' performance such as OSFI, clerkship discussions, and SDL reports. Results in this study was also compared with those in year 2019 to observe batch variation under the integrated curriculum. Since there is only slight difference between two batches, thus the batch variation under the integrated curriculum is minimal. Moving on, the table shows the percentage of positive responses between all curriculum which the graduates graduated in 2015, 2016 and 2017, and under integrated curriculum which graduates graduated under 2019 and 2020. PO1 involves the knowledge in pharmacy has showed a decrement. Thus, it is recommended to put more weight on evidence-based management and concepts of organizational behaviors to promote future pharmacy leaders with excellent patient care skills. For PO2, although the percentage showed an increase, it is still under 70%. Thus, it is recommended to move industrial attachment to special semester, where students can be trained longer as PO2 concerns with industrial pharmacy. Subsequently, PO5 showed a decrease, and the suggestion to curb this is to conduct more events like pill workshops where pharmacy students will have interprofessional socialization with medical students, as PO5 concerns with interprofessional collaboration. PO6 and PO7 involve the pharmaceutical care skills and information management respectively, and the suggestion to increase attainment of this PO is to have hospital attachment for more than 2 weeks so the students can practice these skills. Finally, PO8 involves the management and entrepreneurship skills, and to strengthen these skills, it is recommended to have actual business project in the syllabus, as Shahiwala found that this project helps students to understand the concepts more clearly. Finally, the overall satisfaction of graduates. In the series of questions asked in the survey, an average of 79% agree that hospital attachment, industrial attachment, and community attachment should be longer. Thus, to recommend moving all three attachments into special semester so students can be trained longer. For workloads and assessment, only 45.7% agree that the weightages of assessment are equally divided. Thus, to recommend focusing on more individual assessments, as 62.9% prefers if there are more individual assessments. Last but not least, 71% agree that online learning makes certain subjects more confusing and difficult to learn, and only 34.3% agree that they have adequate skills for online learning. Thus, to recommend encouraging the use of user-friendly technology, and perhaps lecturers could adapt new teaching technique to explain complex concepts to students, such as online blackboard. In conclusion, graduates have attained 5 out of 8 POs. Comparison between graduates and employers' perspective showed only slight difference, while comparison between indirect assessment with direct assessment illustrated major differences. Comparison between different cohorts concluded that integrated curriculum is better, however improvement must be made, and graduates are only satisfied with the performance of lecturers and staffs and current teaching and learning method. This study has some limitation. First, it has moderate response rate, which could lead to non-response bias, and most respondents are in clinical settings, which could lead to biased results. Thus, to increase response rate, perhaps incentives could be provided. Other than that, modifications and improvements are needed to ensure all students attain all POs, and annual evaluation of PO is recommended to assess effectiveness of curriculum from time to time. And these are my references. That is all from me. Thank you.